At this time, I would like to turn today's program over to Canada Health Infoway. The floor is yours.
Thank you very much, and welcome everyone. My name is Simon Higgins. I'm the Director for Benefits Realization here at Canada Health Infoway, and I'll be your moderator today, taking you through our webinar on the 2015 National Change Management Survey. So welcome. A few introductory slides before we get going. First, a notice of recording, just to let you know that we do record these for future use. And we would ask that you use the question and answer feature on WebEx to ask questions throughout. In the course of the recording, none of your names will be used. I've got a brief disclaimer here. I'll just give you a moment to read the disclaimer. And then I'll introduce myself and our presenters. So our first presenter today will be Karen Taylor-Hughes, who's a benefits realization leader here at Canada Health Infoway, and she's going to be talking about the Change Management Survey. And we're also pleased to be joined by Jim Nick from Manitoba eHealth, who will be talking to us a bit about the governance and leadership approach that they apply in their projects. So we've got a great combination of topics today. So thank you, Karen and Jim, for joining us. So a brief overview about what we'll be covering today. The first topic, as advertised, is the Change Management Survey. So looking at the findings from this exciting survey about what are the leading practices, how are those leading practices being applied across the country, some of the enablers and barriers, and a little bit about awareness and use of our Infoway's National Change Management Framework and Toolkit. One of the more important themes that came out was the importance of governance and leadership for effective change management. And so we've invited Jim to join us on the webinar and talk a little bit about Manitoba's work in this space. We've got a really great example to share with us. So those are the two components of today's webinar. Just to share with you, this is the online question tool. This gives you a bit of a visual about where you're going to enter your questions. Please do enter questions throughout the course of the webinar, throughout both Karen and Jim's presentation. You can ask questions about either of them. When both of their presentations are completed, I'll take back the microphone and we'll walk through some of those questions. I'll be reading out questions for Jim and Karen to answer. So don't hesitate, because it's better to have questions in the queue for us to have ready to go once Jim and Karen are done their pieces. So without further ado, our feature presentation, I will turn it over to Karen Taylor-Hughes to share with us the results of the Change Management Survey.
Thanks very much, Simon. I'm very happy to share these results. This is a very exciting time for us, having completed this survey and sharing the results with the folks out there to hear what's going on with change across the country in healthcare. Initially, I'll give you a little bit of background in terms of our change focus. In 2009, a group of change management professionals tasked with leading change in their organizations in healthcare got together to look at what are the key things they need to do, how can they adhere to best practices, and support their organizations through, at that point, a lot of change and a lot of big changes. So this is when the Pan-Canadian Change Management Network formed. And their mission is basically to really educate and promote the value of change management. And they wanted to be seen as a leading national network for change management, especially in the healthcare sector, which is the case at this time. When the group got together and they realized that they needed a change management framework that supported change from a healthcare perspective based on what they were doing for their projects. So they conducted an environmental scan of all the existing frameworks to discover what were key best practices, but also looked at what was required from a healthcare perspective. And they came up with 6 core elements. And this is what came to be known as the National Change Management Framework. The 6 core elements are governance and leadership, stakeholder engagement, workflow analysis and integration, communications, training and education, monitoring and evaluation. This is a framework that is recognized nationally. It's being also used internationally in sectors also outside of healthcare. So it's something that, as a group, that we're very proud of, and it's available on our website. And on our Infoway website, you will see this under change management. If you search for that, the framework, and in the framework we embed not only the key elements, we explain them, we have examples of tools that can be used to address these areas, and we also have literature reviews in terms of what's going on in these areas as well. So there's a wealth of information available. So when I speak about the survey, we will talk about the change management framework, and this is the document that we're talking about, and that's sort of the background of that. This has been out since 2010. After 2010, people were very busy working on projects in healthcare because there were so many things going on, so many changes, that we decided after about 4.5 years, it was maybe time to get a pulse and get a sense of how change is maturing and growing in healthcare. So we put together the change management survey with input from our benefits realization folks at Infoway, as well as our National Change Management Network members who are change leaders, to give us some good questions to address, to get a sense of how change is being addressed across the country. We then commissioned Ipsos Reid to support us, as well as providing us with some support, as well as focusing on the survey on the key enablers, barriers, resources used for change, and best practices, and also acknowledging the framework to see if it's being used and leveraged out there. The framework was available online from January 28th to February 12th. We were happy to say on our first route that we had 379 people complete the survey with representation from every province and territory. Sorry, this might be a little slow there. We were happy that our survey, we wanted to make sure that it would be actually able to be covering all the different sectors of healthcare, roles and settings. So we focused on change leaders and change supporters. So folks who were responsible for change, like a change manager or a project manager, and those that their key role was supporting, whether you were a clinical change champion or a peer leader, et cetera. So as you can see, we had good representation in terms of roles as well as settings. One of the key questions we asked was, are you currently working on a change initiative? And we were surprised that not everyone said yes. 62% said yes. And then we can kind of see across the different healthcare settings what level of change initiatives are going on. What was very interesting for those that were going through change, significantly at 57%, changes were going on that impacted more than 500 people. So that told us that there's lots of change going on, and it's not little change, it's quite large change impacting over 500 people. Another way to get a pulse and a sense of how change is being integrated into healthcare as a discipline was to ask the question, is there a dedicated budget for change? Because we know if things are valued and put an importance on and part of what you do, there's usually a budget for it. So we discovered that 32% said, yes, there is a budget. And we sort of asked another question as to what things are included in that budget. If you have a look, you see the key things are training, communications, change management staff, clinical informatics staff, and project materials. So again, there is a budget for change that was clearly identified, but the range and the scope of things that are included is not quite where I think it should be at this point in time. When asked are there problems filling roles in change, we discovered that finding a change leader with the expertise for change is hard to find, as well as getting clinical champions on board. Clinical champions are folks who work frontline, nurses, doctors, any kind of allied health staff that are actually going to be implementing the change and leading their peers. So those are folks that are hard to find to support change as we go forward. When we asked about, in regards to a methodology for change, do people actually follow a change management methodology, 50% said yes. They had selected a methodology and they adhered to it. Then we asked, do they conduct change management training for their staff Of that 50%, 53% said yes, they did. So that lets us know that even though they have a methodology, not all their staff that are leading change are actually being trained on change management processes. In that 53% that have actually formal change management training, we realize that clinicians are among the least likely to have had change training. So you can see here the peer leaders, the clinical champions, the director or manager of professional practice are not getting that change management training. But as we know from the role of clinical champions and peer leaders are very much heavily involved, or should be, in leading change in healthcare. So we've identified that there are gaps in engaging the clinical side of change. And we've realized that not always do we have clinical leaders responsible for change or adoption. Only 48% say that's consistently happening. And only 24% say consistently that they're documenting clinical requirements from a clinician's point of view. And then we asked them, did your change management approach include clinical champions? 20% said yes, always, and then 33% said most of the time. So only 53% of the time are clinical champions engaged in supporting change. When we asked about the framework, we asked people, are they aware of it? Out of the group that were surveyed, they said 44% said yes, they are aware of it. And for those that were aware of it, reflected quite positively on the tools and the information available on our website. So again, that's a good testament to the work that the Change Management Network group has done in putting information together to be available to their colleagues. When we look at governance and leadership, one of the key areas of the change management framework, we discover that not always do they have a senior leader accountable for change, which of course can be problematic because without someone senior in the organization to lead change, it's have a hard time getting traction and being successful. And we also asked, are project leaders accessible to make decisions? And again, not all the time. So only 8% said always. So again, as you know, there are lots of challenges and barriers in healthcare when we are conducting initiatives. And you need that senior leadership and project leaders to remove barriers to keep the project moving forward. So certainly from a governance and leadership perspective, there's opportunity to increase that approach. Stakeholder engagement side, 36% say a structured stakeholder engagement process is used most or all of the time, which I thought was interesting because when we look back at the change management budget question, most of the activities included in the budget are around communications, which involve stakeholder engagement. So that was quite interesting that but they didn't have a structured process. I think that could be partly because, again, with lack of clinical folks helping, not engaging all the right people at the right time. And again, communications, we know there's budget for communications and things are being delivered. But again, from a governance perspective, we're not always delivering key messages by senior leaders to help people establish and understand the priority of the change. That's only happening 12% of the time. So we know there are tools, and we mentioned project newsletters, et cetera. When we did in our survey, we asked what are the most effective ways to communicate to project team members and impacted stakeholders. Number one, at 95%, was anything in person or close to face-to-face. So that's presentations, phone calls, those kind of things, meetings, all of those things. The more directly in contact with an individual, the more significant and more impactful the communication. And we see that things like emails and webinars and intranet are also impactful, but not to the same effect. So definitely, whenever things can be done, communicated in person, much more effective. Workflow analysis and integration. When we created the framework, we discovered in that work that it was the most important piece that was missing from all the other frameworks that existed, and that was because in healthcare we're looking at moving technology into the clinical space, which required always a process redesign and workflow reanalysis. And so we felt it was important that we put that in as a key consideration, that when someone was doing change management and looking at doing change in healthcare, that they spoke to and actually completed this task of workflow analysis and integration. So we asked the question, is workflow conducted on your change initiatives? 13% said it was done all the time. And then 30% said most of the time. So really, only 43% of the time are they actually committing most of the time to looking at workflow, which is actually a little distressing because, again, as you know, out there, every change you do requires some kind of workflow change. And so it's very important, and I think it's the basis for success in moving forward. Training and education, another key component to our change management framework. And we know that people have acknowledged that training is important. It's in one of those budget items that we mentioned earlier. 61% say they provide segmented training by user type and role most of the time. So when we ask the question, segmented by user type and role, what's important about that is when you're conducting training, it's important that training be done for the people who are going to be using it at their time in the role that they are doing. So only 16% said that happens all the time. So typically what happens is sometimes a group gets together and they go through the tool, but they may have a person that does administration, someone that's a frontline nurse, someone that's an allied health person, someone that's a physician, and they're getting a sense of how the whole tool works, but not specifically what's required from them. So that can actually help training not be as effective as it could be. And then only 14% said that that the training education was workflow-based. Again, we felt that was critical to do the analysis and integration, and then secondly, make sure that when you're training by user type and role, that you're following the new redesigned workflow. So again, still some room for improvement there on the training and education side, even though everyone acknowledges training and education is important. Another question we asked that's not here is that education component reflected in that there is continual ongoing training and education on the tool to learn additional functionality, learn some tips and tricks, and that too is not being really adhered to as well either. So lots of room for improvement on the training and education side. When it comes to monitoring and evaluation, 35% say their change management process includes review and monitoring of change tactics. That's really important because as you embark on a project, we've done several webinars, CHIO being one of the latest ones where they actually presented twice, talk about you have a plan, you move forward. As you move forward, you sometimes recognize that the things you thought would work are not working, and you have to tweak them or revise them or change them moving forward. And most of the projects tend to be quite lengthy, and therefore they have a phased rollout. So it's really important to acknowledge what things are working and what things are not and change them on a regular basis. So at 35%, that happening all the time is not adequate to support good change support. As well as we ask the question, is there a post-implementation review conducted to be able to document lessons learned to be used in future change initiatives? One thing we've learned for sure is that change is constant in the world, in healthcare, and there will always be a new change initiative around the corner. It's best to learn and understand your organizational culture and be able to build on what you've learned in the previous change to add to the new one. So there certainly is an opportunity there to track and monitor change tactics as you go forward. When we ask folks, what would you need to help develop and do the role of change better, they said some of the support needed from a change resource perspective would be information on workflow analysis and integration. Not everyone is using things like Lean or Six Sigma, and therefore are looking for tools to be able to go in as a non-workflow or process redesign specialist to conduct workflow analysis and integration. We have tools online that support that, and so we realize that's really important. Again, stakeholder engagement, looking for a process to be able to identify who your stakeholders are, do an analysis, and be able to prioritize which ones require what type of support. And again, governance and leadership, very important in terms of understanding what are some good governance and leadership best practices and how can they implement them in their projects. Again, we asked them what's most helpful in terms of hands-on support. They felt that having more project resources would be the #1 thing, saying that there definitely is need to bulk up the change management approaches and the teamwork and the staff required to lead a change on a project. We also asked an open-ended question specifically about what are the top enablers and barriers for change. So the top enablers were visible, engaged senior leadership, stakeholder engagement, and clinical change champions. Our top 3 change barriers were having too many competing priorities, lack of visible, engaged senior leadership, and lack of effective communications. In 2014, the Conference Board of Canada conducted a survey amongst 60 HR leaders across Canada involved in leading change, and they asked them what some of their top challenges were when it came to managing change. Top challenges include organizational and leadership change expertise, resource capacity, which kind of speaks to our competing priorities, stakeholder engagement and communications, and change fatigue. So interestingly enough, very similar, and these were folks from across a variety of sectors all across Canada. So we're getting a sense that it doesn't matter what sector you're in, the effects of change management in terms of a discipline and maturity are the same across any sector. They also asked these folks how effectively are they managing change at various complexities. So project-based change is in the 60s in terms of how it's being addressed. Strategic change, not so effective, and transformational change, even less so. So despite the prevalence of change and the less than stellar results reported by participants, the use of formal techniques for change management is not widespread. In their study, they also asked the question, how many of them are using a formal change management process, and only 32% said they use one always or usually. And these results are in line with IBM's global study, which found that only 24% of organizations consistently use systematic approaches. So again, there's lots of room for change management to grow and to mature. I think these are still early days, but nice to see that our results are certainly not obscure. They're in line with what's been done and what's been tracked across the world globally, across all sectors. So a quick recap of our key findings today. Change is going on across Canada in healthcare, and it's impacting a lot of individuals. 50% of organizations follow a change management methodology. A third of respondents say change activities are part of a dedicated budget for change management. Less than half of the respondents have participated in formal change management training. 44% of respondents are aware of our framework, and they found the tools useful. We've identified there is a gap in clinical engagement in change initiatives, and looking at the framework key core areas. Governance and leadership, 39% say a senior leader is accountable for change most or all of the time. From stakeholder engagement perspective, 32% say a structured stakeholder engagement process is used most or all of the time. Communications, 46% say messages are delivered by the senior leader most or all of the time. And from workflow analysis, 43% say that workflow analysis and integration is being conducted most or all of the time on their change initiatives. Training and education, 61%. So they provide training segmented by user type and role most or all of the time. And from monitoring and evaluation perspective, 35% say Their change management process includes review and monitoring of change tactics. That gives you an overview of our findings and our key pieces that we've discovered and we've discussed today. We have more information on our website where you can go and look at this slide. There's also a poster and have a look at that. But one of the things that we found that was really interesting was one of our key enablers and one of the areas that's a key barrier is visible, engaged leadership. So I was very happy to be able to speak to Nick from Manitoba eHealth in Winnipeg to share with us his project-winning project, their approach to governance, and share with us what they've done to address governance best practices and how they have been successful with that. So at this point, I'm going to hand it over to Jim, and thank you very much.
Well, thank you very much, Simon and Karen, and good day, everyone. Let's see if I can advance that slide. Today's goal, as Karen mentioned, is to, in the next 10 to 12 minutes, you'll hear how a standard, consistent, repeatable governance model was used to implement significant change, an admission, discharge, and transfer best practice solution within 13 hospitals in Manitoba. To provide a little background, there are 5 regional health authorities within the province, with the Winnipeg Regional Health Authority being the largest. As with most provinces, each RHA operates somewhat autonomously, and historically, individual hospitals have selected and implemented different ADT software solutions within their respective hospitals. These different vendor solutions, combined with years of customization, created an environment of multiple sets of unique systems, processes, forms, policies, and data. The patient experience varied between hospitals, and the ability to share data became very difficult. Our project vision was a single best practice solution, a common standard for all hospitals using a shared database. As most of you know, ADT is the starting point for most patient visits and is considered the heart of any hospital system. ADT has a wide-ranging impact on people and processes, and for example, at Seven Oaks General Hospital in Winnipeg, the change impacted 800 staff, 30 units, and 13 interfaces to downstream systems. The existing ADT systems were aging and different, which decreases supportability and consistency, leading to more downtime, errors, and redundancy. The benefits of the project were intended to improve patient care, enhance data sharing, and reduce operating costs, while positioning Winnipeg and surrounding hospitals for increasing future patient volumes. Common ADT becomes a prerequisite for the electronic patient care record, or EPR, which requires having a single source for patient demographics. There were a number of keys to success, and I'll spend the most of my presentation on the first 3, but I wouldn't want to omit the last 3. Site subject expertise. Directors and managers of the participating admissions departments were seconded to the project for between 12 and 16 months to build the standard and develop the site implementation strategies. The team itself was multi-skilled, comprising representatives from Manitoba eHealth, our customer community, and our vendor partners. Teammates came to the project from hospitals with defined and often varied cultures. To facilitate stakeholder engagement, a common project culture with shared values was developed. The project culture and values needed to support standardization and large change initiatives is, in our opinion, one of safety. It's okay to have an opinion, it's okay to make a mistake, it's okay to raise issues and concerns. It's important to create a project culture that encourages cooperative problem solving, a safety culture was necessary to prevent issues from going underground and reappearing at some future point when they are much more difficult to resolve. And in addition, project team members were trained in common standards for project management, and our method is PRINCE2, common standards for change management, which is PROSCI, and management of risk, which is management of risk. The greatest contributor to project success was active, visible executive sponsorship. Wide-ranging systemic organizational change meant the project executive needed to have sufficient organizational legitimacy to set expectations, establish clear project objectives, make timely decisions, resolve issues, assign resources, and hold others accountable. We were lucky in that our initial project executive was the chief operating officer of our region, and in fact the second in command, who together with the CEOs of the participating hospitals created and championed the vision of a standard, consistent, best practice through the various site activations. The executive was personally engaged, communicated directly with site CEOs and staff, and didn't waver in their support. Project governance is the management framework within which project decisions are made and is a critical element of any project. While the accountabilities and responsibilities associated with an organization's business as usual activities are generally well defined, one often discovers an equivalent management framework needed to govern the development of an organization's capital investments or change initiatives is missing. For example, the standard org chart provides a good indication of who in the organization is responsible for any particular operational activity the organization conducts. But unless an organization has specifically developed a project governance policy or framework, no such chart is likely to exist for project or change-related activities. Now, the composition of our steering committees has changed from what might have been large representative stakeholder committees, usually upwards of 15 or more people, working with terms of reference, possibly, to a standard, repeatable, role-based model incorporating written job descriptions and single points of accountability for all project participants, including steering committee members. The model has 4 levels of accountability. Above the steering committee, there's usually an authorizing body, a funder, who is in essence commissioning the project based upon a defined business case with measurable benefits. And in our case, that's the Department of Health. The steering committee directs the project, authorizes 1 or more management stages, and is accountable to Manitoba Health for project success. Our average steering committee size is now between 5 to 7 people, organized around 3 specific roles, and those are a senior user, a senior supplier, and an executive. The project manager drafts the project approach, creates the project plan, requests resources, and manages project stages, and those are generally in the range of 6 to 8 months, according to time, scope, cost, quality, risk, and benefit criteria approved by the steering committee. Team managers are accountable for delivering specific work products or services that meet defined criteria, usually approved by the project manager. On our ADT project, we had a full-time dedicated change manager participating in stakeholder identification, current to future gap analysis and workflow solution design, and was responsible for drafting the change management, communications, and training strategies supporting the various site activations. The same structure is now employed on all of our medium to large capital investments or change initiatives. As mentioned, the Project Steering Committee is accountable to Manitoba Health for the success of the project and has the authority to direct the project within the limits set by Manitoba Health. The Steering Committee owns the vision and approves change management strategies and all external communications. The first role, Project Executive, is ultimately responsible for the project and has to ensure the project gives value for money while balancing the demands of customers against the abilities of suppliers to deliver workable solutions. The second role, Senior User, is responsible for specifying the needs of those who will use the project's deliverables, for user liaison with the project team, and for monitoring that the solution will meet those needs within the constraints of the business case. The Senior User represents advisory committee interests, commits customer resources, and resolves issues. The Senior User specifies project benefits and is held to account by demonstrating that the forecast benefits, which were the basis of project approval, have in fact been realized. It's the Senior User or customer representative who signs off that the solution is fit for purpose and has the responsibility for benefits realization. On our ADT project, the Senior User role was performed by the Regional Director of Health Information Services, supported by the admissions department leaders from the various hospitals, most of whom were seconded to the project to develop the standard. The third role, the Senior Supplier, represents the interests of those designing, developing, facilitating, procuring, and implementing the solution or final deliverable. They are responsible for confirming the viability of the project approach, that it will in fact deliver a solution that meets customer requirements. If it can't, the steering committee becomes a forum where the issue is discussed between those who have needs, the Senior User, and those who provide solutions, the Senior Supplier, until the solution is resolved, hopefully in a timely manner. It's important to note the steering committee is not a democracy controlled by votes. The executive is the ultimate decision maker and is supported in the decision-making process by both the Senior User and the Senior Supplier. These roles should be performed by senior leadership. They must have sufficient organizational legitimacy to make decisions, approve plans, allocate resources, and resolve issues. They also have defined change management responsibilities. As I mentioned, steering committee roles should be performed by senior leaders who are personally engaged in the project, leaders who communicate directly with their staff, leaders who hold people accountable, and who are unwavering in their support of change. The executive takes a lead role in building the sponsorship coalition, including managing resistance from other leaders and managers. Our ADT Leadership Coalition was led by the Chief Operating Officer, who involved the various hospital CEOs in creating the long-term vision. The Senior User built a similar coalition of hospital admission department directors, and when a specific hospital was activating, the site CEO and site Senior User led the implementation and became responsible for benefits realization at their hospital. So, did the project achieve its goal? Introducing a single best practice standard created significant change in our community and tertiary hospitals. Standard role-based project governance, active, visible executive sponsors, and structured change management were key to our success. In 2014, the project team was awarded Project of the Year by the Manitoba chapter of the Project Management Institute for its innovative approach to project delivery. Better news is that the project hasn't ended. Our regional health authority partners have asked to be included in the vision, and over the next 2 years, we'll implement the standard solution into the remaining hospitals across Manitoba. So we think the project's been very successful, and I'd like to thank Simon and Karen and Canada Health Infoway for asking us to tell our story.
Great. Thank you so much to both Jim and Karen for your rich presentations with lots of interesting information for everyone. So now's the time when we'll be taking questions, and I just need to advance the question slide. Reminder that we'd like to take questions within that online tool. So please do submit them. We've got a couple ready to go, but encourage you to get in there and submit them sooner rather than later so we can get through as many as we can in about the next 15 minutes. So I've got a first question here for Jim, and it's about the decision-making process, how you came to this governance model. Jim, can you tell us a bit about how you came to select this model, or if there was a source you used for it?
Well, the basic model is contained in our project management methodology, and it has a fundamental principle that everybody working on a project, including steering committee members, must have job descriptions. And what we did was to take the drafts that are contained in there and to augment those positions with specific change management responsibilities, particularly at the steering committee level, and where possible provide training in the methods to team members and steering committee leaders.
That's great. So it sounds like it was you took some kernels of an idea, but you really customized and built the approach yourself for the most part. That's exciting.
I think it's, yes, you have to tailor these things to meet your own individual situation. While you may have a standard recipe, you know, you do have to change the ingredients to meet your own particular situations.
Okay, great. So, Karen, a question for you here. Obviously, you talked about some of these results being a little bit, you know, many of the best practices are under 50% of uptake. And I guess the question is, was this a surprising result, given the view that you have on the Canadian landscape here at Infoway? Are you surprised to see that the uptake of the best practices is as low as it is?
I would say a little bit surprised, knowing that I'm so heavily steeped in the change management side of things and know most of the practitioners across the country working in healthcare, that they're working hard and pushing this envelope. I was a little bit surprised, but at the same time recognizing, like project management as a discipline, change management is just really getting its legs as a discipline in the world, in all the sectors, and actually was encouraged after reading the conference board survey results as well as IBM's global study with only 32% and 24% adherence to a methodology, that at least in healthcare in Canada we're at 50%. So at least people are acknowledging change is important. I think we're ahead of the curve in healthcare in Canada in that sense. Is there room for opportunity for adherence? Absolutely, and hoping that we can support that in the ways that are effective. But a little surprised, but actually encouraged that things are moving forward, and I'm hoping that in 2 to 5 years, that number will be significantly higher and we'll be seeing everything in the 60 to 70 range.
Excellent point, Karen. Really appreciate you sharing those comparators. It's a good reminder that while sometimes these things may look a little bit grim, a recognition that that we're making substantial progress in the industry and are ahead of many peer industries as well. So that's a really great reminder. So your last comment there is a good tie-in to one of the questions we had, which is, will we be repeating this survey in the future?
I would hope to. I think now that we've started, and it was the first one of its kind, I think there's been a lot of interest in the findings. It's sort of the source for one place of all of where healthcare is going and what we're doing on the change front. So I'm looking forward to doing it again in 2 years and having lots more respondents as people are now hearing about the survey and the results, and I think want to participate and see how things are going. So looking forward to that opportunity.
Great. Okay, thanks, Karen. We've now got a question for Jim next. And the question is, it looks like the project management methodology is based on Prince2 principles, and is that the case? And if so, did you follow the stage-based project lifecycle management?
Yes, we are a Prince2 shop and have been for the last 7 or 8 years. And we do follow the standard project life cycle of ideation, initiating a project, building a stage, closing a stage, opening the next stage, repeat that, and eventually closing the project and measuring whether or not benefits were realized.
Great. Thanks very much, Jim. So I've got another one here for you, Jim. There wasn't a substantial mention of clinicians. So the question is, how do you involve clinician leaders in your governance structures?
Clinicians actually are actively involved in our governance structures, and they usually perform one of the 3 steering committee roles. It could be the executive, the leader. It could be the representative of the stakeholder community, the clinician requirements, or in the case of an existing solution that we're trying to extend into other clinical areas, they could be performing the senior supplier role and providing that solution to other facilities. So clinicians are actively engaged in all of our governance structures.
That's great. Great, thank you. Karen, we've got a question for you. Someone wondering about sharing these results. So we want to know if they want to be able to share these results with others in their organization, what's the best way for them to do that? What are the sort of resources available to them to do that?
I believe as of this morning on our Infoway website, the slide deck that we just went through from the Canada Health Infoway side is available. We also will be posting the video webinar webinar in about a week's time with all the audio and the slide deck for both Canada Health Infoway and Manitoba eHealth will be available online. So definitely the deck is now available online, and the video and the webinar will be coming shortly. If you have any questions, you can certainly contact our clinical adoption at Infoway email to ask any questions if you need any questions or more support or any more details about the survey. But it's available now.
Great, perfect, thanks. Another one for you, Karen, and that is about first steps. So for an organization that is fairly low on the maturity level, might not be applying a standard change management methodology, maybe is only adhering to a few of the basics. I think training was one that was common. But what are the kind of the first steps that you would recommend for organizations that want to move up the maturity curve in this?
Well, I would sort of in some ways adhere to our framework. In the framework, we have sort of listed them in 1 to 6 in terms of foundational to tactical. So I think it's having that senior leader that would be responsible for change, as Jim's role is, he is responsible for change and project management at Manitoba eHealth. And so having someone that would champion that role for you as a senior executive that would then provide the support, the budget, the open the doors for other projects to be gone, and to also provide support around change in terms of resources. So firstly, find a change leader, executive sponsor who understands change, knows what their role is, and what their role can be in leading and supporting change. Then secondly, I would look at selecting a change management methodology, having a change leader, someone who on a tactical level would lead projects, and then looking at change teams and how you would implement. And that is really based on your organization in terms of what resources are available, whether they're centralized, housed, for example, in the PMO, or they're distributed across the organization where every department will have someone that will jump in as a subject matter expert who can support change as their departments have change going on. So those are a couple of first steps. You'll also see on our website we have a checklist saying, is your organization ready for change? And it goes through a series of steps that you can consider to see if you're ready for change, and it will also help you move along the maturity scale. So that will be a helpful resource as well.
That's great. Thank you very much, Karen. That's a good segue to our next slide. So we don't have any more questions in the queue right now. By all means, if you have a last question, tap it in now. As I do the last moment or two of closure, we can probably squeeze in another one. But I will just move along. As Karen was referencing, there are a substantial number of tools and resources available to support organizations trying to do this work, and so we try and make these available as much as possible on our online repository, and of course have networking opportunities through the network and through our LinkedIn page. So I really encourage people to come and check out these resources and engage with us and with the rest of the community that's out there. I think if there's one thing that we've learned in this work over the years, it's that this is a community activity, and we all learn from each other. So by all means, if you're not part of that community now, get on board, join us and get in on the conversation. So we don't have any more questions. I'll just move to the slide that says thank you. Really appreciate your time today. Thank you very much to both Karen and Jim for some excellent and thoughtful presentations. I learned a lot, and I hope everyone on the line learned a lot. And for those of you on the line, we look forward to seeing you at the next Change Management webinar. All the best, and have a great rest of the day.
And thank you again for joining us today. This concludes today's web conference, and you may now disconnect. Have a wonderful day.